I have removed the anterior part of the rib cage on both sides. The manubrium has been cut through just above the second costal cartilage. Below, I have retained the costal so that you will be able to see the attachments of the diaphragm. Here remains the internal thoracic artery and vein. You can remove those. The parietal pleura folded back, and you can see its membranous character. Below that is the lung. That is the lung surface. And the diaphragm. The color of the lung in fixed material is dark with black areas of carbon deposition. This is quite characteristic of fixed material. Here again is the diaphragm, doming steeply upwards. The heart, within its pericardial coverings, and the left lung. We can pull the lung over laterally. Note that it is easy to move around. The heart is rather large in this specimen and requires to be pushed over. We push it over to the left. You can see the hilum of the lung. This is the region where the major blood vessels enter and leave the lung, along with the air passages. The object of the dissection will be to cut through the hilum. You use a scalpel and, as far as possible, keep close to the lung rather than to the heart. The heart, of course, is in my right hand. In many of your cadavers, the lung will be firmly adherent to the parietal pleura. The surface layer of the lung, the visceral pleura, is normally separated from the parietal pleura by a potential space. But in many cases, scar tissue is formed, and this will not be present. I have now turned to the left lung. The right lung has been removed. The lung is pulled over laterally, and the heart pushed over to the right. Here again is the hilum. Take a scalpel and cut through the hilum. And you will see straight away vessels are cut. These, in fact, are the pulmonary veins. You can cut right through the hilum. It is difficult at this stage to sort out the pulmonary arteries from the pulmonary veins, but it will become clearer later which is which. Cut right through, stick to the lung surface. Below there is a reflection of the visceral pleura called the pulmonary ligament. You now put a hand in, cut any remaining adhesions, and pull the lung up. Again, I am fortunate in this instance there are very few adhesions to hinder the progress. The lung is now pulled up, and we have an excellent view of the hilum of the lung. That is clotted blood within the major blood vessels. Pulmonary veins, pulmonary artery, and air passages. These are the major bronchi. We will study this in more detail on the teaching desk. We are viewing the right lung from the costal surface, that is, the surface related to the ribs. The impressions left by the ribs can be seen. The surface of the lung is lined with visceral pleura. That shows quite nicely. Here are the speckles of carbon laid down during life. The lung is divided into 3 lobes: an upper lobe, a middle lobe, and a lower lobe. The fissures that divide this can be seen. This is the horizontal fissure dividing upper from middle lobe. The oblique fissure can be seen there very clearly, and this is the lower lobe. The visceral pleura dips down into the fissures, right down towards the hilum of the lung. You can turn the lung over and view it from the mediastinal surface. That is the surface related to the midline structures in the chest. The heart is related here, the right atrium. The superior vena cava passes up there, and there is a very pronounced groove which is made by the azygos vein. The bodies of the thoracic vertebrae are related to this region, and you can see the impressions left behind by them. Here is the hilum of the lung. Note that it dips down here as the pulmonary ligament. This is merely an extension of the reflection of the visceral to parietal pleura. The structures in the hilum: here is a pulmonary vein with blood clot in it, and below is another branch of the pulmonary vein. Further up we can see pulmonary artery here, and you can see its wall quite clearly. It is as yet undivided. You can see some of the divisions carrying on down there. Finally, the most posterior structure, there is one there, and one going up into the upper lobe. These are the main bronchi, and indeed that is the bronchus going to the lower lobe, that is the bronchus going to the middle lobe, and that is the bronchus going to the upper lobe. If I squeeze the lungs, you will see air coming out of those, which is proof of the fact that they are air-containing structures. We are now in a position to study the left lung. This is the left lung, the costal surface. Here are the impressions left by the ribs. The left lung is normally divided into 2 lobes, an upper lobe and a lower lobe, separated by an oblique fissure. This lung is anomalous because it has this lobe down here. We will look now at another lung which shows more classical features. Costal surface, the upper lobe, lower lobe, and the oblique fissure. Note that on the upper lobe there is this projection of lung tissue called the lingula. This takes the place of the middle lobe of the right lung. Above this is a notch called the cardiac notch. Returning to the original lung, we'll now turn it over and look at the mediastinal surface. Related to this region is the left ventricle, and here is a very pronounced deep groove, which is made by the arch of the aorta and the descending aorta. Above here you will or may find 2 more grooves, made by the left common carotid artery and the left subclavian artery. This is the lingula, which in this particular specimen is very small, and above it the cardiac notch. If we look more closely at the hilum of the lung, these are the pulmonary veins. Above is the pulmonary artery. Of course, this is blood clot within the lumen of the vessel. And showing very well here are the bronchi. This is the upper lobe bronchus, and that is the lower lobe bronchus. Note the thick wall, and here showing extremely well is the cartilage, which is to be found in the wall of the bronchial tree. Now we'll look at the other surfaces of the lung, which we didn't see on the right side. This is the inferior surface and is concave. This reciprocates the shape of the diaphragm. The apex of the lung is above and shows well. I will now do a small amount of dissection around the hilum of the lung. Before we look more closely at the hilum of the lung, we can see that the visceral pleura, I will peel it back here, can be taken off the surface of the lung quite easily. Its membranous character shows very well. The carbon granules can also be seen. I'm peeling it back. You can see just how easily this is done. Replace that. You will find that when you dissect the hilum, there will be many lymph nodes. I have retained one such lymph node, again containing carbon. These can be lifted out as discrete nodules of lymphatic tissue. The hilum has been dissected. I will hold it together as it was before I started the dissection. You will be expected to have some knowledge of the way in which the bronchial tree divides up. The trachea divides into two main or principal bronchi, one to each lung. These will divide into lobar bronchi, and you can see them here, upper lobe bronchus and lower lobe bronchus. The lobar bronchi will divide again, and these are called segmental bronchi. The region of lung supplied by these segmental bronchi is called a bronchopulmonary segment. A detailed knowledge of this anatomy is not required, but some of these segmental bronchi I have dissected out, and I will demonstrate them for you. This, remember, is the upper lobe bronchus. That is the apico-posterior segmental bronchus. Here is the anterior segmental bronchus. This is a bronchus to the lingula. If we now look at the lower lobe bronchus, here it is. This divides usually into 5. This is the apical or superior segmental bronchus of the lower lobe. These are the basal segmental bronchi. This is the median basal segmental bronchus. This is the posterior basal segmental bronchus. And if I lift this back, we can see another division which is partly dissected. This will divide into a lateral and anterior basal segmental bronchus. I have retained some of the blood vessels. This is a major branch of the pulmonary artery. Here we have branches of the pulmonary veins. You are not expected to do very much more dissection than I have done here. We are now looking at a resin cast of the bronchial tree. Here is the trachea, the left main bronchus, the right main bronchus. Here are lobar bronchi. That is the upper lobe bronchus on the right, middle lobe bronchus, and lower lobe bronchus. Upper lobe bronchus on the left, and lower lobe bronchus on the left. Note that on this cast you can see the ridges left behind by the hoops of cartilage in the walls of the bronchi. The lobar bronchi divide into segmental bronchi, and in this cast the territory of supply of these segmental bronchi is shown in different colours. In black and white you can get some idea of how this is occurring. This is a very detailed piece of anatomy, and there are many casts in the dissecting room for you to look at more closely. The pulmonary arteries tend by and large to follow the same pattern of division as the bronchi. The pulmonary veins tend to branch between rather than alongside the bronchi. This space, which is very evident, would normally contain the heart. That now completes the dissection of the lung and bronchopulmonary